Hello, welcome. Stefan Hartman here, Iron Direct Primary Care. Today we're talking about female hormone testing, best way to find out. So I get asked this question, what is optimal hormone levels? If you look at the LabCorp reference range or whatever lab you're using, it's like, what? I mean, it makes no sense what they're talking about. The best way I found is, have a baseline if you can. If you don't have that baseline, that historical baseline, then the second best is to test your children. If you're older adult, middle age plus, and you have children, teenagers, test them, and then you can do a side-by-side comparison like this mother-daughter duo did. So let's take a little look at this. I'm try to zoom in a little bit so that we can see this stuff. Let's see, 200%. Here we go. So, can't fit that all on the screen here. Here we go. Look at this. So left is the mom, 57-year-old, daughter 19 on the right. Take a look at this. Here her mom's T3 is 2.7. Now LabCorp will flag that within the reference range, but that is by no means optimal. Optimal is 3 plus, and you can see the daughter's free T3 is 3.8. Again, we don't really pay too much attention to the TSH. That's just a signaling hormone. I mean, it's not a real hormone. T4 and T3 is what we want to look at. We want optimal T3 levels. That's the active thyroid hormone metabolite. If you're just going to test one hormone, you test the T3. Most important, free T3. Besides that, everything else looks pretty good. No autoantibodies against the thyroid, even though both these two are taking iodine. Mom is taking at least 50 milligrams of iodine a day in an attempt to replenish her body with iodine. The daughter is taking a regular dose of iodine, about 12 milligrams. But it looks like we're going to put this mom on thyroid hormone to get her to her daughter's levels. Get her more energy, more mental clarity, focus, less joint aches, pain, right? CBC, not too much of a difference. The white blood cell count is a little bit high in the daughter. Neutrophils are a little bit high in the daughter. The daughter is dealing with a little bit of gut issues, has had some antibiotics in the past for acne. This may prompt us to do a little bit of gut microbiome testing or other stealth infection testing for overgrowth yeast bacteria, etc. Look at the glucose panel. You can see mom is a little bit intolerant to carbs, it looks like. This is pretty common, with age. Women will get low muscle with age, they'll get higher fat with age, and they just don't do well with carbohydrates and glucose. Now, mom is trying to eliminate a lot of carbs because she's not tolerant to them very well, having high fasting blood sugars. It's not terrible, but it's elevated. Even, I agree with LabCorp's reference range here. Anything really above 99 is just too high for a fasting blood sugar. So we try to reverse that here at Iron DPC with a muscle-centric medicine approach, growing the muscle. I talked to the mom. Mom wasn't really physically training. She was doing, a little bit of, high-intensity weight swinging, or she called it like dynamic exercise. This is not progressive resistance training program. Progressive resistance training program is structured, focused, building up the muscle, increasing the load week after week. There's a lot of marketing out there, mostly towards middle-aged women, where they have them do jazzercise or these movements, these Zumbas and stuff. This is not weightlifting. This doesn't grow the muscle. The muscle is a storage form for glucose. It stores it in the form of glycogen in the muscle. You're not going to get bulky like this. I get women all the time. They're like, I don't want to look like you. Oh, I take offense at that. Like, oh, no, you look good. I'm a woman. I'm like, listen, I've been trying to get bulky for years now. It's not going to happen. Like, I guarantee this. If you get bulky, I'll publish that, okay? I'll publish that in a case study. If a 57-year-old woman turns out looking like me, this is going to go in the archives of history. Okay, it's not going to happen. Just lift weights. It's going to improve your glucose metabolism. Let's see, what else here? The iron levels actually look pretty similar between mom and daughter. We'll see a little bit later. The ferritin's a little bit different. Testosterone levels. So mom's testosterone total 31, her free is 1.6. Daughter's testosterone is 59, free of 3. So almost twice. The daughter has a lot more testosterone. Mom, of course, describing kind of classic low libido, low muscle mass, low energy. So we're going to try to improve this testosterone for mom, bring her up a little bit, give her some testosterone replacement. Now, pregnenolone, I unfortunately didn't measure it on the daughter. I should have, because it's high. It's going to be high. It's always high in young teens. Upwards of 200 is what I typically see. Maybe I can get one of those cases for you all. But this is with a bit of replacement, actually. So mom was probably even lower before that. 53 is a little bit on the low end. Estradiol. So we are replacing mom with estrogen, estradiol. Mom didn't have any estrogen before this. So with a bit of a topical 1 milligram replacement, she's up to about 38 on estradiol serum. Daughter, mid-luteal phase testing, estradiol of 141. So, this isn't super high. It's not super low. It's kind of like right in the middle where you might want to see it, might expect it. Of course, daughter's A1C is better, 5.2. Mom's is a little bit high, indicating, as we saw in the fasting blood sugar, mom is probably running high blood sugars on average. Now, mom's DHEA is 267, and mom got kind of scared about this because she saw the LabCorp reference range was 29 to 220. It's absurd. If you had a DHEA of 29, you'd be falling apart. So, mom, we replaced her DHEA. It went above the reference range. Mom got a little bit scared. No side effects. Mom feels great, but she's worried about the reference range. Look at daughter. Daughter's not taking any DHEA. Daughter's DHEA naturally is 491. Wow. Now, mind you, daughter did have a little bit of acne issues, and this is probably the main downside of high DHEA levels, is oil on the skin. But the issue with age is dry skin. Older folk get dry, thin skin. They can't retain their moisture. They get dehydrated more. Their skin doesn't look as good. You want higher DHEA levels. It's also very important for your brain. It's a neurosteroid. It's integral for your bones, your heart, etc. You want a higher DHEA level. Okay. Other things to look at. Let's see. Vitamin D levels, 87 in the mom, 62 in the daughter, just because mom's taking a bit more vitamin D. Let's see if I can get the insulin-like growth factor. So insulin-like growth factor is 224 in the daughter, age 19. IGF-1 in the mom, there's 111. 111 IGF-1. So that's very low. So optimal IGF-1 levels will be between 200 and 350, really. That's what Dr. Thierry Hertog suggests for preventing aging. Mom has growth hormone deficiency here, quite clearly, very low IGF-1 levels. And you can see that in her skin, the lacking elasticity. She has osteopenia, was diagnosed years ago with weakening of the bones, not growing muscle, glucose insensitivity. So all the problems associated with age. Growth hormone does decline with age. So LabCorp here has a bit of an age reference range, and you can see the younger they are, the higher the IGF-1 levels will be. When they're growing, it can go upwards of 600. This is super high IGF-1 levels. I haven't even seen that high in a bodybuilder shooting 10 units of growth a night. So that's really hard to achieve unless you are, a growing child. But daughter 19 still having great growth hormone levels, 224. Fantastic. CRP, let's look at that. Pretty good. That's mostly from diet and lifestyle, I've found. So both have very good CRP levels, very low. B12 levels, mom's a little bit higher just because she's probably taking a little bit more vitamins, a bit more consistent. Progesterone levels, we are replacing mom's progesterone, 200 milligrams per night. Mom says this is the best thing is for her sleep. She says she knows all these women in her friends circle, and they all talk about how they can't sleep. She was the same way until she came to Iron DPC. First thing I do, woman can't sleep, progesterone. It's it should be in the textbooks. It's not, though. You get all these psychiatric drugs for insomnia. You tell the patients to take Benadryl and these hydroxyzine or atypical antipsychotics to make them sleep. Progesterone is natural. You need it. You don't have it with age. Give them progesterone, they sleep again. Now, mind you, on a blood test, you won't really detect progesterone. That's just what I found. LabCorp, most testing, they don't detect progesterone even if you're taking 200 milligrams a night. Daughter's progesterone is 5.1 mid-luteal phase. Again, this isn't necessarily optimal. Progesterone should actually be a little bit high. Her ratio is a little bit off. I think with just a bit more iodine supplementation, some more vitamins, we probably get this progesterone up. But again, progesterone is really finicky to test for it. I mean, she says she did go day 21 of the cycle, so you should see a bit higher progesterone there. Insulin levels, so both of them decent insulin levels. Now, here's the catch. You want low fasting insulin levels when you're on a fasting blood work test, but here's the catch. So mom's glucose was high, right? Remember that? Her insulin was also low. So typically, I want insulin to be low, but not when your glucose is high. When your glucose is elevated, your pancreas should be releasing insulin to lower the glucose. If that's not happening, there's a little bit of a mismatch here. It's possible she may actually need a bit of insulin to lower that glucose. Her pancreas may not be producing as much. Now, I don't go and put patients on insulin for this. We just focus on growing the muscle as robust as we can because it becomes a better glucose sponge. You can think of your musculoskeletal system not as a lever, but as an endocrine organ, an immune organ. It functions to like a second pancreas, essentially, right? You need less insulin release to lower glucose when you have robust muscle system. Now, daughter's insulin, 6.5. It's a little bit high, but it's okay. Between 2 and 7 is okay. If everything else matches up, this is fine. Lean athletes, oftentimes, very lean individuals, they'll have very low insulin, below like 3. Now, ferritin levels, daughter's ferritin levels was 25. Mom's ferritin, I don't know why it's not showing up here. It was actually kind of high. And that's kind of a classic thing with older women. They don't bleed every month. They can accumulate ferritin, high iron stores. Well, this woman wasn't even on testosterone yet. Her testosterone wasn't even that high. Testosterone, of course, stimulates bone marrow production, red blood cells. Higher testosterone levels typically lead to storage of ferritin and iron in the body. So postmenopausally, it may be necessary to donate blood for some women. And of course, you don't want to have, here it is. I just missed it there. Ferritin's right here. 168, so kind of high. High ferritin levels, this can lead to ferritin deposits in the liver. It can cause liver inflammation. You don't want super high iron levels in the blood. Ferritin causes oxidation in the blood. Not necessarily a good thing for cardiovascular health. So you just donate. If you're not bleeding and you have higher ferritin levels, just donate, go do a good deed. You help yourself out, right? That's pretty much all I had to say here. Magnesium, RBC, we tested that in mom. Again, I get a question all about like how much magnesium do I need? You should have a regular bowel movement every day. If you don't, you're probably constipated, likely due to either low thyroid function or lack of magnesium in the diet. So you dose magnesium to bowel movement. That's what I tell a lot of patients. And the second, if you're having muscle cramps. Muscle cramps is typically a sign of electrolyte abnormality. This can be sodium, potassium, and magnesium. You need all of these. But the most common denominator is magnesium because no one gets enough magnesium in the diet. So that's that. And yeah, so if you don't have a record of your own blood work, a graph over years, if you don't have a testing done when you were 19 of all the hormones, and no one has that because no doctors were doing this back then, check your daughters, check your sons, see what their labs are. Are they healthy? Are they great athletes? They don't have problems? Check them. And then you can kind of use your own children as a reference range. Don't rely on the reference range that LabCorp, Quest, Vibrant, they give you. It's not useful. It's based off, I don't know where they invent this stuff, actually. I mean, this must be extremely diseased populations. Right? DHEA level of 29, I mean, come on. These people have got to be falling apart with that low DHEA level. This is not normal. So don't rely on the reference range. Don't get scared when it's outside the reference range, like it's the red zone. You follow up with, iron TPC. We actually understand these levels. We don't base it off what the lab tells us. I mean, a patient's not a lab marker. A patient's not a lab company. A patient's a patient. We dose the hormones. We dose the vitamins off the patient's symptoms, how they're feeling. And yes, the labs help guide us, but they're not the end-all, be-all. Hopefully that helped and was entertaining for you all.